Hello and welcome to another edition of Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen Blakelock, and joining me is Vanessa Paddy, Coordinator of Diabetes Management with Hardin Memorial Health. Thanks for being here, Vanessa.
Thank you for having me.
Well, diabetes is affecting a lot of people, and I know we have a lot of important information that we're going to be sharing with our viewers today, specifically maybe some tips on what to look for those individuals that may not even know if they have diabetes, and maybe some tips for those individuals that do have diabetes as far as taking care of themselves. Let's start with a little bit of some startling, I hate to say, statistics, because we do know diabetes is affecting not just the adult population, but even the youth population. Do you have any information for us there?
Well, the American Diabetes Association reports that there's about 26 million children and adults affected with diabetes today. But in addition to that, there's another 79 million people that have a condition we call prediabetes. What that means is that your blood sugar is not quite high enough to meet the diagnosis of diabetes, but it's not normal either. So therefore, you're at risk of developing diabetes sometime later in life. And then they're also estimating that by the year 2050, that 1 in 3 Americans will have diabetes. So our problem is growing daily, and so we have to get some action going to try to stop this this terrible growth of this disease.
Absolutely, and you just hit the nail on the head, because we really have heard about diabetes. You know, it's been with us for a period of time, but that growth is really quite a startling, again, statistic that we have just mentioned. So you talked about prediabetes, and we heard the term also blood sugar, blood glucose. You've heard those terms before too. Tell us a little bit about maybe what a normal number is and what prediabetes actually that range is.
If you go to your doctor and he orders blood work on you and it's done what we call fasting glucose, meaning that you've had nothing to eat for at least 8 to 12 hours prior to having the blood drawn, a normal fasting blood sugar should be between 80 and 100. To be diagnosed with diabetes, your blood sugar needs to be greater than 125, and usually on more than one occasion. When your blood sugar falls in the range between 100 and 125, that's when we label that as prediabetes, again being at risk for developing diabetes because you're above the normal upper limit of 100, but you're below the 125 limit of diabetes. We can also look at random blood sugars. Say, for example, you go to the doctor and they just test your blood sugar regardless of whether you've eaten or not. If you have a random blood sugar greater than 200 and you're having signs and symptoms of diabetes, which I'll be more than happy to explain to you, then that would be a diagnosis of diabetes. Otherwise, a random blood sugar greater than 140 would be a prediabetes. So between 140 and 200 would be prediabetes.
And Vanessa, you just actually made some great comments, because not just talking about the numbers, but the signs and symptoms, because a lot of individuals have those signs and symptoms and may not put that together that they have diabetes. So let's talk a little bit about those signs and symptoms.
There are some classic signs and symptoms that people present with. One of those being excessive thirst. For example, getting up in the middle of the night for a glass of water, which might not be your norm. Drinking more throughout the day, just seeming to have a constant state of thirst. Coupled with that usually is excessive urination. Again, going to the bathroom more frequently than used to, or maybe getting up in the middle of the night when you hadn't before. Sometimes excessive hunger is also a symptom that we have with diabetes, ironically. Mm-hmm. But I also tell people to watch out for excessive fatigue. They're unusually tired, not tolerating their activities the way they normally do. And then also sometimes blurry vision. Blurry vision that may come and go can be a symptom. So usually if we see a combination of those symptoms, we go to the doctor. I haven't been feeling very well. I'm just really tired, doctor. I don't know what's going on. And they do the blood work, and then lo and behold, we find out that they have diabetes.
Now, we talked about the signs and symptoms. Are there I guess maybe genetics involved? I mean, if you have a family history, or is this, actually anyone can get diabetes, but is there a link between genetics?
Absolutely. There's a strong correlation between family history and diabetes. There are other risk factors, such as obesity, a sedentary lifestyle. Those are major factors. And this is why we're seeing the prevalence of diabetes go up, because our obesity rates have gone up so much and we're having so much more of a sedentary lifestyle. This is also why children are developing type 2 diabetes more often, because they're not out riding their bikes and playing in the yards as much as they are maybe playing the video games, so they're not getting the activity. And diet's so different among children. Those are some risk factors. We also know that there are certain ethnic groups that are at higher risk, such as African American, Pacific Islanders, American Indians. Those types of ethnicities do have a higher prevalence among that. And, of course, there are conditions that you can change and some that you can't. As we get older, we can't change that, but it does increase our risk for diabetes. We can't change our ethnicity. We can't change our family history. But the things that we can change in regards to diet and exercise, those are things that we can reduce our risk for diabetes.
So we're hearing be physically active.
Yes.
Make sure that we're eating a healthy diet. Mm-hmm. And when we say diet, we mean nutrition, mm-hmm. your nutrition status. And then making sure that you're checking with your primary physician as far as your other risk factors that you may have based upon maybe other disease processes, and or they know your family history too. What is a good time, and I guess maybe an age, that we should be screened for diabetes?
Well, there's no set number to recommend. Obviously, if you have greater risk factors, then you want to be checked earlier. If you have those issues, if you're a smoker, you have weight issues, then you'd want to start investigating this earlier. We certainly see patients that are diagnosed with diabetes in their 30s. Now, it's more commonly we start seeing it as patients start reaching their late 40s, early 50s. For a diagnosis. But you really want to think about, are you at risk for diabetes because of some of those things we talked about, and get in and see your physician earlier if you are at risk to do some screening.
Absolutely, and we've stressed, I know, before, really knowing your numbers, and that's one of the numbers they need to know is their blood glucose, or we've heard people say, blood sugar too.
Correct.
Tell us a little bit about, and we've been talking about the signs and symptoms, partnering with your healthcare, professional, and making sure you know what your risk factors are. But what actually is diabetes, and how does it affect our body?
Well, diabetes is a condition where the body cannot regulate the sugar level in the body. An essential hormone in our body called insulin helps us to use this sugar, which is really a fuel source for the body. It gives us the energy we need to do the things we do during the day. Insulin allows our body to use that properly and to store it properly in between meals. When we have diabetes, especially type 2 diabetes, which is about 90% of the patient population with diabetes, we don't make enough of that insulin. Therefore, we have excessive amounts of blood sugar kind of circulating in our body, and that sugar actually has a detrimental effect on our blood vessels in our body, our nerve tissues of our body, those types of things. The other type of diabetes, type 1, which only accounts for 5 to 10% of the population, in those individuals, their pancreas, which is the manufacturer of insulin, has stopped making that. Therefore, they have to take insulin for treatment. The majority of people out there with diabetes, the type 2 folks, they have a deficiency, but they're still making insulin. The other problem that goes along with that in type 2 diabetes is they have what we call resistance to their insulin. So the insulin tries to work, but their body opposes it. And obesity is a major factor in causing resistance. And so those individuals, their pancreas may be working very hard to try to control their blood sugar, but the resistance is so high that it can't keep the blood sugars in control.
So those individuals that have been maybe diagnosed with diabetes, and we're really focusing, I hear you say, on type 2, because that's the majority of the individuals. What involves with the treatment plan? Because you talked about affecting the nerves and affecting the blood vessels. So we know that there are potential complications once you've even been diagnosed with diabetes. So those complications would be heart disease. What else?
Yes, we know that the risk for a heart attack and stroke are increased considerably among people with type 2 diabetes and type 1. Diabetes is also known to be a leading cause of blindness here in the United States. It's a leading cause of kidney failure, and also contributes to amputations from improper wound healing after a wound has developed in an extremity and those types of conditions. So there's certainly several complications, and that's a short list that can occur because of this damage. So when we start working with patients to try to control their blood sugars, our aim is to reduce the risk of those complications. With type 2 diabetes, we often start with diet and exercise. And as you alluded to, diet means proper nutrition, eating healthy, controlling portion size, limiting the carbohydrate intake in the diet because carbohydrates convert to sugar. So we focus on that and try to help the patient develop a meal plan that balances out and includes good healthy food throughout the day. Additionally, we want to promote activity and exercise because that helps us to burn and use that sugar properly, promotes weight loss, and just good overall physical health. There are medications certainly that we can use for patients with diabetes that help our pancreas produce more insulin, help us to overcome issues of resistance, and those are often used in these patients. So we do add those on or may start with those depending on how the severity of the diabetes at the time of diagnosis.
Well, great points, because you talked about a lot of different components, I guess I would say, as far as their treatment and care of an individual that has diabetes. And here you are, the coordinator of our diabetes management program, so it really does take that approach. So what's all involved? Because that's a lot of information for a person when we say, okay, you have diabetes, here you go, and they have to really try to understand everything. So tell us what comes together for that team.
Well, this is a condition you can't learn about in 5 minutes. You have to be able to sit down and understand the whole comprehensive management of diabetes as a person with diabetes. So that's what we teach patients in our program. We want them to understand nutrition, physical activity, their medications. But there are so many other things. There's coping issues, the stress of having diabetes, monitoring their diabetes. Traveling with diabetes can be a concern for people. So we try to offer that comprehensive approach in teaching the patient how to live with their diabetes. Sadly, there's not a cure for diabetes. So we teach patients how to control their diabetes, how to not let it control them, which I think is very important from a coping strategy. So that's how we work with our patients. And we provide individual counseling as well as group classes for patients so they can work with other people who are also dealing with the same concerns that they have.
Well, we have experts in the area because we have nurse practitioner, we have certified diabetes educator, and that's very important that people understand that this is the livelihood of the professionals teaching this and making sure that they're working and partnering again with the person that's been diagnosed. And then the dietitian, because that is such a big component. We have to eat in order to live, but making those choices and understanding what can I have and how can I have a good quality of life. And I love the way you said living with diabetes, because it's a change.
Well, we have that team approach. In our program, we have a nurse who is a certified diabetes educator, a dietitian. Myself, I'm a nurse practitioner that works with those patients. And then we work with the physician. It has to be a group effort in order to accomplish this. The patient is the center of that, and all of us our aim is the same, to get that glucose control in that patient to reduce that risk of complications. And if we work together as a team, with the physician being an essential component of that, we can achieve that. We see it happen on a daily basis, and it's a really nice thing to see.
Great. Now you talked about monitoring, and monitoring is really checking your blood glucose. So we have to not only take the medications, we have to make sure that we're eating right, but they have to also understand that they're going to be monitoring their own blood sugar. We talked about going to the physician's office, maybe initially getting that blood work checked, but they're going to be doing that pretty much.
Right. We feel that daily monitoring of blood sugar levels is essential information for both the patient and their provider. The patient can see what things they're doing that affect their blood sugar in a good way as opposed to a bad way. So it helps them to learn to control patterns of eating and activity. They can see how it affects their blood sugar levels and make the appropriate changes. Then when they take that logbook to their physician's office, they can use that as a means of deciding if the medications they're taking are appropriate or not. So monitoring is an essential element of caring for yourself with diabetes.
Vanessa, you've shared great information with our viewers today regarding diabetes and maybe having them investigate their personal risk factors, those individuals that have diabetes. Where can they get more information?
Well, if they want to go to the intranet, then the American Diabetes Association, their website is diabetes.org. It's full of good, reliable information that the patient can review. Additionally, of course, we do have our diabetes management program at Hardin Memorial Hospital. People who are interested in learning more about that program can simply call us at 270-706-5092, or they can email us at diabetesmanagement@hmh.net. Any of us will be more than happy to explain more about our program or provide them with information to help them take care of their diabetes.
Great. And for additional information, you can always go to Hardin Memorial's website at www.hmh.net and click on HealthLink and/or our services that Vanessa was talking about. Again, thank you for joining us this episode, and we hope you tune in next month for another important edition of Health in the Heartland.